was in quite a bit of pain, and I got to the place where I could hardly walk. I had to walk sideways and bent over. So I came to Dr. Cornett, and he said, you know, what's wrong is that your spine, there's a vertebrae that slipped forward, and no matter what I would have done, it wouldn't have fixed it, and I had to have surgery. I wasn't sleeping at night. I had to sleep in a chair, sitting up. I couldn't lay down for more than 15 minutes at a time. I couldn't walk. I wasn't functioning. I couldn't do anything. I couldn't go out of the house. I could barely get down the stairs. It doesn't stop, and you're not sleeping, you're not moving. And I was taking all the meds I could take for it, and finally got to the point where I couldn't even take the pain pills, because you take so many, then you can't, then you become allergic to them. Dr. Cornett was so calm, he was so confident, and he took the time to show my husband and I exactly what was wrong, exactly what he needed to do. He just made me feel confident, and that's important when you're a patient, and especially when you're really ill. And he really put our hearts at ease. So that really helped too.
She suffered from spinal stenosis, and also she had spondylolisthesis, which is a slip vertebrae at the bottom disc in her spine. Spinal stenosis is when the nerves in our back get pinched, most commonly from arthritis, and things such as bone spurs or thickened ligaments can cause pressure on the nerves. And the pressure on the nerves can then cause pain in your legs, in the buttocks, sometimes in the back as well. She had difficulty walking, getting around, doing the things that she loved to do. Her pain had increased over the years, so it had been going on for quite some time, but it really had been increasing for her. And despite lots of other treatments, her pain was increasing. It's something I see very commonly, several times a day. We do this type of surgery weekly, and it's a surgery that includes unpinching the nerves in her back, the nerves that are pinched that are causing pain in the buttocks and down the legs. And then, given the fact that her spine was slipping somewhat, we also stabilize that area of her spine, which is called a fusion. In general, they do very well. The keys to success with this surgery are picking the right patient, meaning someone that has a problem that's severe enough to warrant surgery, someone that has already tried other treatments and failed them, and then doing the right surgery and doing it properly. She has done spectacular. She really has had significant improvements in her pain. She walks and ambulates better, she's more active, and my understanding is that she's been very happy with her outcomes. The nice thing at Nebraska Medicine is we have all services available. All services are in-house. So really anything that comes up after surgery, during surgery, before surgery, we have the facilities and the personnel to handle that sort of problem. I think that's one of the most rewarding things about what I do, is when you have patients that do very well and they improve their quality of life and can do more activities and live life the way they want to live it. That's a big reason why we do what we do.
I told him he was a miracle worker because, I mean, he goes in there and adjusts a few things and does this stuff, and it's amazing what he can do with his hands. I wished everybody would have the kind of turnout that I've had. It's just changed my whole life around. But I can go out and shop and go out and eat and, go up and down stairs and walk, and it's just a whole different story. It's completely different than what it was before that. And even my husband says, do you realize a year ago you couldn't do this and you couldn't do that? I was walking that day. I walked 50 feet and came back to my room that day. I didn't have any pain, and that was the first time I didn't have any pain for over 2 years. I slept, I laid in bed, and it just kept getting better and better from there. I had great nurses, and he'd come in and visit me to see how I was, and the staff was really, really good. I mean, they made sure I was not in pain, that I was comfortable, and just came in to talk to me sometimes. I'd recommend that hospital, and I recommended Dr. Cornett. When you've been in pain that much for that long, and then it's suddenly gone, I can't even explain that.